Good evening, everybody. Once again, my name is Rudy Page, and welcome to Vaccine Confidence Dialogues. And this evening, I have with me Angela Clark, who's a service manager for adult and social care, and associate professor Donald Palmer. Good evening, both.
Good evening.
Good evening, Rudy.
So how's things?
Busy.
Busy.
You go first, Angela.
Busy.
I know the feeling.
Yeah, likewise, I'm busy.
Great, great. So we've been commissioned by the Vaccine Equality Programme within NHS England to provide a series of activities to support vaccine confidence within the African and Caribbean communities. So over the next few weeks, we're facilitating a series of online dialogues among our professional workforce and our communities, and particularly those we have as our trusted messengers, because it's important for us to counteract the misinformation that's out there. So the purpose for all our activities is really to provide vaccine confidence by ensuring that people have access to accurate information about the COVID-19 vaccination. So I'm going to come to you first, Donald, because one of the key questions that come up all the time is, how did this vaccine get developed so quickly, and was safety compromised?
Well, first of all, I'd like to really thank you for inviting me this evening. It's a privilege to be talking to folks today, and it's also wonderful to see my dear friend and sister Angela, so thank you. So there are several reasons why this vaccine, the time that it took is remarkably quick in comparison to drugs that we consume. But I just want to take there are several reasons for this. One is really around the technology. So the technology for developing this vaccine has actually been around for many, many years. And so researchers have been developing this technology for a long time. There are several other reasons. One is the fact that not one scientist was working on this, but many, many scientists around the world collaborated and therefore were able to produce this vaccine. No safety was compromised. And let me allow just one more bit to say around this. Is when we are taking a drug to be used for human beings, it goes through a series of steps. It's experimented in a lab to see if it does what it's supposed to do. Then it actually is then tested on humans. And people may have heard the term phase 1, phase 2, phase 3, okay? And normally, the key problem with getting a drug to be consumed is the length it takes for these clinical trials, particularly getting volunteers. And normally what happens, you get 20 or 30 people in phase 1. They look at the drug, take the drug to see how it reacts. The data is then collected, that's written up. Then it's now getting more people for phase 2 and then for phase 3. That's where the time's taken. What's remarkable about these vaccines was the phases were actually done in parallel rather than series. So, and also there was a host of volunteers. Yeah. And equally, instead of writing up the data and then submitting it to the regulatory bodies, basically, phase 1 was done with phase 2 and phase 3. And as soon as the data was being produced, it was then given to the regulatory bodies. Mm-hmm. Okay.
Okay. Okay. All right. So we've got that message. Let me come to you, Angela. One of the challenges that we have at the moment in terms of the vaccine, we're still in the period of what's called the high risk groups. So that's our elders and those who have got clinical, I should say, priority groups. Our elders, those who've got existing clinical conditions, health and social care workers, and men. So in your role, what are some of the challenges that are faced within the social care that you're facing within the social care sector as a result of the pandemic? I know there's kind of two questions within that. You know what I mean?
Yeah, of course. I mean, certainly the one of the first challenge is the extent to which social care is provided. It's provided across so many different areas. So, you know, you have social care that takes place in care homes, for example, and you've heard, you know, about the issues around the people in care homes being high priority and at risk. You have social care that is carried out in people's homes, you know, with domiciliary care workers, and they are from the social care sector. So I suppose it's, and, you know, then you have daycare and all of the different other services that are carried out. So from that perspective, because, you know, because of where people are based, they could be anywhere. And social care workers will be going into any location. That in itself causes risk. That in itself makes it quite a challenge, because keeping something like this confined is very, very difficult, because, you know, you are talking about people in the community as well as people who are, yes, there are people in hospitals, but there are, as I say, people in care homes, and then you have the potential spread is easier.
Right. Okay. And we're going to talk about that a little further on.
Yeah.
Thanks for that. So, Donald.
Yeah.
A key question that is also asked is, does the vaccine really work?
You know, the vaccine does work. And I want to give you some examples for that. But I want to come back to your first questions about why the vaccine, why it was done quickly. And as I said, I want to reiterate, no safety was compromised. But there's a couple of other points which actually relate to this question, in the sense that a significant amount of money was given to researchers to make sure this actually worked. Right? And I'd like to give the analogy. It's a bit like, for example, you know, when we talk about building a house. So, you know, we've all seen these house programs. You know, if it was 20 people to build a house, you know, it'll take quite a while. But if it's 200 people, a house can be built in a matter of weeks. Now, the question about does the vaccine work, it's actually the case now that the data shows this. And this is what the clinical trials done. So basically, people were vaccinated. Okay. Now, what's really important is the fact that how our body works, our immune system. And the key thing about what our immune system does is basically it produces what we call antibodies. Think of them a bit like, you know, like soldiers. The soldiers are produced, and those soldiers float around your body, and they will then destroy any microbes. You know, imagine, for example, you know, you've got a house and somebody wants to burgle your house. You've got soldiers at the door to prevent the burglar from coming in, okay? So we now know, and in fact, these are what the clinical trials showed, that individuals that were vaccinated, and they were then compared to those that were not vaccinated, the so-called placebo group, those that were vaccinated didn't actually get disease. Equally, they didn't, if they got disease, they didn't get the severity of the disease. Now, in the UK, as well as world over, millions of people have now been vaccinated. And what was done in the clinical trials has now bared out in reality. And what we now know, for example, is that those that have been vaccinated, even with one dose, there is a limited the severity of the disease. And this is remarkable because this has been looked at in older individuals. And you have to remember, at least 25% of individuals that sadly passed away in the UK were of that age group.
Yeah, and just getting back to the testing,
yeah,
the testing did include people from all ethnic backgrounds as well.
The testing was amazing. So the testing included people from all background, but of all ages.
Right.
Up until you know, the youngest being 18. But here's the remarkable thing about the testing, Rudy, Angela, was they tested people with risk factors. So 10% of people that were in the trials were obese. Another 10% had cardiac diseases. So what they made sure is what they tested when they did the clinical trials. They actually did the clinical trials on general population, which is rare. When you do clinical trials, particularly the early ones, you do it on healthy volunteers.
Yeah.
Right? That's really important.
Yeah.
Sure.
This time, they actually said, well, hold on a moment. Given the fact that we're going to, you know, it's going to be used by the general public, the clinical trial has to reflect the general public. And so that's what they did. And here's now the important thing. You know, one of the things they weren't clear on is does the vaccine work in terms of transmission? Yeah. And if you look at the principles of vaccines, they do that. Vaccines will prevent disease and also prevent transmission. And in fact, these vaccines do. The evidence has been now shown that there is a reduction in transmission, because basically when the body produces these soldiers, even if you get the virus, your body's trying to get rid of it. Vaccines aren't 100%, but at least there's increasing evidence, severity of disease is reduced, and the limited ability to transmit is also reduced. Not completely, but it does reduce.
Right, and you raise a good point around the transmission of the virus. So can you talk about that in a little bit more detail in helping people to understand, you know, being asymptomatic and how the virus can spread within families, at work, and you know, in communities, before I come to Angela again?
Yeah, I mean, you know, what viruses want to do, like any other living organism, right? They want to live, okay? It's the principle they want to live. Now, the best way to live, right, is if it's a bit like a burglar. You want to get into somebody's house and not be detected, and then go to another house and not be detected.
Yeah, cool.
Right?
Yeah.
And this is what viruses will try to do. Viruses will try, where possible, to go into individuals and don't cause disease. Because if they don't cause disease, they're not detected, but also your immune system is not alerted.
Okay.
And therefore, they're able to go from one individual to one individual to one individual.
Okay.
All right. But once a virus causes symptoms, right, one, you will remain at home because you don't feel well, but also your immune system starts to attack it.
Yeah.
Right. So the difficulty, therefore, is how then do you detect anybody who is asymptomatic? And that's how viruses can quickly spread in amongst the community, which is why it's important, therefore, that everybody gets tested to see if they've got the virus.
Yeah. Okay. So, and the variants, we're hearing a lot about variants now. Could you say a bit about that?
Well, again, this is classic. This is what viruses do. Virus mutate. You know, they will try and make sure they will be at the advantage of, so if I can spread from A to B, they will then change to make sure they're at the advantage.
Yeah. Right.
And we see this. And I'm sure most people will be aware that when it comes to winter time, when it comes for most of us who are in, folks who are in their 60s or whatever, when they get the flu jab, you know, they will look at the strain that's currently out in the population, and then you'll be vaccinated for that strain. And it's the same thing, strain, mutant, it means the same thing.
Okay.
And so, you know, this year, this is the particular strain that's prevalent, you know, in terms of flu. Next year, it might be a different strain.
Okay. Okay.
Basically, you know, that's how mutants arrive.
Right. Okay. Some stats came out a couple of days with regards to the low uptake. So within the African communities, it's 58.8%, and Caribbean communities 68.6%. 7%, whereas the general population who've been offered the jab were at 90%. So I know that that's been a challenge as it relates to health and social care workers. So what has been your approach to that challenge, Angela, in your work?
Well, it's been interesting because part of my role within adult health and social care was actually having to manage, open and then manage a designated COVID unit. So it was actually dealing with only positive patients who were optimized to be able to be discharged from hospital, but then had to come into a unit to be cared for during their period of isolation. What we found what I found interesting was certainly the difficulties that I had in actually getting the staffing. The majority of the staffing for that were not people from minority groups at all. There were maybe one or two, but not very many in the unit itself. But what I also found was that the more information, or maybe the more information that came out, you did see an increase in vaccine uptake from the minority groups, but not certainly not at the pace that you saw from the white employees. So you say that it's 90% and it's 50+%. We saw that for a long time, but we have definitely seen a steady climb.
Yes.
But it's taken a lot of awareness. It's taken a lot of targeted awareness as well. The Director of Public Health had to do webinars specifically targeting minority groups, and I suppose that was the approach that was taken to try and educate and inform. And still, I mean, I'm not saying that it's where it should be, but we are definitely seeing an increase in take up.
Okay, yeah, thanks for that. So Donald, I'd like to, and we're touching on the benefits versus the risks and the consequences of not taking the vaccine, as Angela's spoken about. Obviously, why health and social care workers are important, because they're dealing with vulnerable patients and vulnerable people. So that kind of brings me also to long COVID. So can you give us your perspective on those two?
Yeah, I think the challenge for scientists and the medical profession is to understand what long COVID is. It is still unclear, but because it covers a myriad of symptoms, right. And that's what makes it complex. Nevertheless, there are some common themes, and that is where there is fatigue. Individuals find that they just can't go through a whole day of working. So while there may be different symptoms, it's quite clear they take a long time to recover, but they never get 100%. And so what you find with long COVID, and that's what makes it really difficult. Some people will be, after a few months, I'm 90%, and they'll be like that. Others will be, will take a long time to recover and remain at 50% for a long time. So it's really difficult to work out what's going on. I know now, currently, hospitals are now starting to open up more and are actually now starting to engage and interact with such patients to try and understand what is going on in terms of these individuals. Now, compare that to the risk of getting the vaccine, and people I've spoken about important to know what those side effects are. And again, those side effects vary. But the side effects are, in general, pain, where the arm where it's been injected in the arm. You may get headaches. You may get shivers, and you might even find that your stomach is not. I'm not feeling so good with your stomach. But these are short term.
And everybody's different, of course. as well.
Yeah, and everybody's
Yeah.
different. I got vaccinated. Nothing. I didn't feel anything.
Yeah.
Whereas my partner was, you know, for a day or so.
Yeah.
So what I want to point out, which is something which folks should be aware, the side effects is a reflection of your immune system.
Okay,
right?
that's interesting.
So for example, when you get infected, if you're not feeling well, one of the things you find is that you get tired because your immune system is starting to work. And the other thing that's equally known is that you start increasing body temperature because that's the body's response to try to slow down the growth of the virus or the bacteria. Viruses and bacteria don't like high temperatures. So the body is deliberately trying to, to say, okay, I've been infected. I'm now going to respond to that infection. And part of the reason why you get a headache is because your body is producing various factors. So what the vaccine is doing is mimicking an immune response, but using something that does not cause disease.
Okay. So that kind of then leads me to another question then, Donald. When people ask that, well, can they fight COVID just taking vitamin D?
No. So, and in fact, there's, vitamin D has been discussed, and there's some recent studies that have come out. Don't get me wrong, vitamin D is important. It's an important, in terms of your immune system, right? It's about your immune system being fit. And I would say, please do take your vitamin. But the vitamin on their own can't actually,
we're back to that balanced diet again that we've always told people.
Diet.
Yeah.
But equally, you have to remember, and it's really important to get this across, is that when we talk about vaccinations, it should be noted that apart from clean water, vaccines have been one of the most important things in terms of increasing life expectancy. There are three key things, diet, the fact that, we now know about diet and having, proper food and etc. Clean water, but vaccines, and I guess for many of us, we've had childhood vaccinations, but smallpox, measles, etc. Those serious devastating diseases, which thankfully we don't, have. You have to remember, over 100 years, in the 1900s, life expectancy was, was 40, 50, because
that's right.
people would die, sadly, of childhood diseases.
Yeah, that's only 3 or 4 generations ago. I mean, it's not that long.
Not that long, no.
Yeah.
So it's important. So we actually know a lot about vaccines and how they work. So the side effects you see with this COVID vaccine is similar to side effects with other vaccines. And that's where I said we know how they work. They have a general principle, and these do the same thing.
Okay, thanks for that.
That's right, because even in the social care sector, the Hep B, it needs to be taken, the flu vaccine, and social care workers take that naturally. But for some reason, when it comes to this vaccine, there is a resistance.
Interesting.
And to comment to that, I think that makes for resistance or concern around where it's just really a lack of knowledge.
Definitely.
You were doing, Angela, what you were doing, Rudy, in making people confident, and more importantly, being informed, being aware, so they can make an informed decision. Because and I guess because COVID is so new, people are thinking, what? In theory, scientists have known about COVID. It's a family of a virus called SARS. And we've known SARS, we've known the sequence, so we've known a lot about that particular family. But because it's not been so well thought of within the public sphere, I think, well, this is new. Whereas flu's been around for hundreds of years. So everybody knows.
Yeah, and there's some understanding, public understanding, as it relates to flu in a way that obviously, with this.
And so what you can easily do, and in the absence of say public messaging, and this is why I rate what you guys are doing, is that so when people say the vaccine contains 5G, it contains a chip, it can alter your DNA, it contains animal products. you know, hold on, what?
Misinformation.
Yeah, but no one could say that about the flu jab because we
Yeah.
know that would be nonsense.
Yeah.
We would dismiss that because we know a lot about it.
Yeah. And the important thing as well, the NHS, the first line in the NHS constitution says the NHS belongs to the people, to all the people. And our people are working in the NHS. So our workforce, it's our communities.
Yeah.
Our communities is the workforce. And it's a very high percentage of the workforce are from our communities. And people do need to remember that. So, Angela, coming to, in terms of your work now around encouraging colleagues to take the vaccine, what kind of steps have you been taking in your
So as I said, we have seen a collaboration, I suppose, with health, with public health and CCG, and put on webinars and things like this, really, so that start and sending it to staff directly, sending information, giving them opportunities to ask questions. So a lot of work has been done. It's been done collaboratively.
Yeah. So you've done a lot of create work within the system itself.
Definitely.
That's the key thing. And that's one of the things that we're having to look at. And that's why we're focused on the workforce. There's the system itself as well as the community.
Exactly.
And
exactly.
that's really important.
And it has to be in language that people understand, really, because I think that the way that Donald has so eloquently explained it, it's palatable. It makes it so much easier to understand, and that's what's important about it. About programs like this. It's making sure that it's easy for people to understand and relate to.
Yeah. Great.
Yeah, one comment. Angela, sorry to cut you, but because one of the things that's interesting. So I've been an immunologist for 30 odd years, right? No one's actually never really wanted to know what I did.
What is it?
Or what I do.
Define it for us. Whilst you're here, define it for us.
Well,
immunologist.
So an immunologist is somebody, or is about how, or the term immunology is really how does our body respond to germs that cause disease. So when you think about a lot of diseases that are caused by basically how they enter into our body, so for example, like salmonella, that's by food poisoning, and that how does our body respond, or through flu, or sometimes when we cut ourselves, germs can get into our body, and things like sepsis, and it's a real problem. But I guess I can understand why people are naturally wary or confused, because I've been studying immunology for many years, and it's only this year I've been actually doing public engagement.
I understand that, because
prior to that,
nobody was interested.
No one was interested.
I know the feeling, because in my work, in working within the system for so many years, most people didn't see or understand what I actually do, but it's because of the Zooms now, they've got a sense. But this is what I do all the time for the last 20 years, particularly within NHS and community economic development.
Yeah, and Angela's right. And this is what you're doing is good, Rudy, because when you watch the TV, they don't have time. You would have heard the term T cells, B cells, antibodies. And if you,
what does that mean?
The stuff they're talking about is what I teach medical students and veterinary students who are in there, so these are guys who have done A-level biology. This is degree stuff. So when they're talking it on the TV, you're thinking, and that can cause confusion. And so when people hear the term, they know the term DNA, genetics. Then you've got something called mRNA. What's going on?
And that's why you find a lot, certainly when we ask these social care workers, what are their decision about the vaccine, there's some that are fine, they take it, there are a lot that say definitely no, but there is a high proportion of people that say, I'm just waiting.
Yeah.
I'm just waiting. I just want to see what's going to happen. Let other people take it and let's see what happens.
Yeah. Even though 20 odd million have taken it.
Well, now, yeah.
And if people were concerned
Yeah.
about, they're thinking, oh, let's wait and see. One of the things we know about vaccines is if they are going to cause problems, and there've been very few, but when they're basically in the lab, when they're doing early studies, this is not in humans, when they're doing tissue culture work and doing the experiments, if there are any side effects or really detrimental effects, it's very earlier on. So I know some people are saying, well, hold on a minute, what's the long-term effect? Vaccines don't work like that, because once you get rid of the virus, let's say in a normal infection, once you got rid of flu, that's it. You're done. You see.
But it's no different to when, it's no different to when someone has an infection.
Yeah.
And they have to take a sample and grow it just to see what the right antibiotic is that's going to actually fight that infection.
Yeah.
Is it a similar thing, I would presume?
And once you've done your course of antibiotics, you're done.
You should be fine, yeah.
Yeah.
Great. All right. And on that great note, I will thank you both, and no doubt we will meet again somewhere in this space.
Yes, we will.
Sure.
Thank you very much, and
Thank
good
you.
evening. Thank you. Bye.
Thank you very much.